My name is Dr. Daniel Fahim. I'm a board-certified neurosurgeon and a professor of neurosurgery at Oakland University William Beaumont School of Medicine. I teach the medical students at Oakland University about brain anatomy every year. I give them their cerebral cortex lectures to teach them what parts of the brain do what. I'm going to very briefly try to introduce you to some of the different functions and different parts of the brain and what they do. So I'm holding in my hand here a model of a brain, and this is about as large as a human brain is. It sits, of course, inside the skull, just like this. Down here at the bottom is the brainstem, and in the back of our head, is a part of the brain called the cerebellum. That's involved with coordination and coordinating some movements and things of that nature, primarily. In the front of the brain here are the frontal lobes, and these are really special in humans. They're much larger in humans than in any other mammals. And the frontal lobes are sort of what make us who we are. That's where personality, decision-making, executive function, planning, and all these more complex emotions that we experience as humans all live in these frontal lobes in the front of our brain. So an injury there can cause problems with some of those issues. At the back of that area of the brain is what's called the motor cortex. It's shown in the blue strip here. And that's where movement is controlled for our entire body. Now, the right side of the brain controls movement for the left side of the body, and vice versa. Just behind that, shown here in pink, is a sensory cortex, which is where everything that we touch, for example, and everything that we feel touching our skin or so on, or every time our foot hits the ground, that information is carried up to the sensory cortex. And then further back is a part of the brain called the parietal lobe, where we integrate some of the things that are happening around us. So, for example, where we are in space, interacting with the world around us, understanding the implications of the things that we see, and speech, and the things we hear, and so on. Further back, shown here in blue, is the occipital lobe, in the back of the head. And that's where vision is processed. Now, vision takes up a large part of the human brain because our vision is very precise. We can see the world around us in great detail and great color, and we're able to integrate the information from our visual world with all the other experiences that our body may be experiencing all around us in the parietal lobes and in some other parts of the brain as well. Now, speech is very interesting. Of course, speech is a relatively unique human phenomenon. Some other animals, of course, have speech, but our speech is much more developed and complex. Now, normally that's in the left temporal lobe for most humans, particularly if you're right-handed. And there are several different areas in speech where speech is heard and understood, where speech is processed, and where speech is made. And all these different parts of the brain sort of surround the temporal lobe and the lower part of the frontal lobe. Now, the reason that's particularly important is because if you have a problem in the part of the brain near speech, it's incredibly important that an awake craniotomy be considered for your care. In an awake craniotomy, a patient is awake during the operation, and we can stimulate their brain and see which parts of the brain are actually involved in speech. The reason that's so important is because if we just put someone to sleep and operate on this part of the brain without keeping them awake and checking their speech throughout the surgery, they could wake up without their speech function. Speech is so important to who we are. Understanding the people around us and being able to communicate with them is a big part of what makes us human. So if you're facing an issue involving this part of the brain, it's important that you see a specialist like myself, who can perform awake craniotomies and every other kind of operation on the brain in order to keep you safe during your operation. Other parts of the brain, of course, are involved in other functions that can be monitored without keeping you awake during surgery. We can monitor sensory function, motor function, without keeping you awake. We can monitor different nerves that go to the face, the cranial nerves, also while you're asleep during surgery. But if something involves the speech cortex, you need to be awake during the operation. I'm Dr. Daniel Fahim. If you have an issue involving your brain and want an expert to weigh in on your care, or provide you with a second opinion or a treatment recommendation, I'd be more than happy to take care of you.